I request Dr. Kabilan M to present his paper.
Good afternoon everyone. I am Dr. Kabilan and I will be presenting my paper on study of correlation and prevalence of Concha Bullosa and septal deviation in patients with chronic sinusitis. Chronic rhinosinusitis is defined as a chronic inflammatory disease of nasal and paranasal sinus mucosa where symptomatology has continued beyond 12 weeks. Septal deviation is a common pathology of the nasal cavity in general population with a reported prevalence of 18 to 57%. Concha bullosa, the pneumatization of the middle turbinate, is yet another common anatomical variant of the sinonasal complex. Its prevalence widely ranges from 13 to 72%. The role of deviated nasal septum in the etiology of sinusitis remains unclear. Likewise, the relationship of Concha bullosa to sinus disease continues to be debated. Hence, we sought to analyze the association of septal deviation and Concha bullosa in patients with chronic sinusitis. Aim: to study the association of deviated nasal septum and Concha bullosa in chronic sinusitis. Objectives: to study the variants of Concha bullosa in patients of chronic sinusitis, to study the types of deviated nasal septum in patients of chronic sinusitis, and to establish the association between Concha bullosa and deviated nasal septum in chronic sinusitis. Methodology: this was a prospective observational cross-sectional study for a period of 2 years at a tertiary care center. The sample size was 67. All patients were subjected to detailed history taking and clinical examination. Diagnostic nasal endoscopy was done, and after that they underwent CT scan paranasal sinuses. Observation and results: a total of 67 patients of chronic sinusitis were studied. The youngest patient was of 17 years of age and the oldest was of 60 years of age. Majority of the patients presented with facial pain, nasal discharge and nasal obstruction. There were 25 patients in the age group of 16 to 30 years and 26 patients in the age group of 31 to 45 years and 19 patients in the age group of 40 to 60 years. There were 43 male patients and 24 female patients. Among the participants, 57 of the patients, the maximum number had C-shaped DNS, followed by 10 patients who had S-shaped DNS. Along with these, 14 patients had DNS with spur and 5 patients had DNS with caudal dislocation and 7 patients had septal thickness. With the Concha bullosa, most number of the patients had bulbous type of the Concha bullosa, followed by lamellar with 27 patients and 2 patients had extensive type of Concha bullosa. You can see the Concha bullosa in both diagnostic nasal endoscopy and the CT scan of paranasal sinuses. Among the patients having Concha bullosa, a large number of patients, 47 patients had unilateral type of Concha bullosa and 20 patients had bilateral type of Concha bullosa. Among the patients with unilateral Concha bullosa, the 78% of the patients had septal deviation on the contralateral side, while 22% had the septal deviation on the ipsilateral side. So, similarly, with the patients having bilateral Concha bullosa, 69% had septal deviation to the opposite side, that is the contralateral side, and 31% of the patients had the deviation on the same side. Discussion: there was a clear association between the presence of unilateral or a dominant concha in case of bilateral concha and the presence of nasal septal deviation. In almost every case, there was some preservation of air channels between the dominant concha and the nasal septum. Moreover, there was a significant relationship between the presence of Concha bullosa and deviation of nasal septum to the contralateral side. Conclusion: the most common variant of septal deviation is C-shaped among the patients which I have studied, and bulbous was the most common type of Concha bullosa, and there was a strong association between the presence of Concha bullosa and to the nasal septal deviation to the contralateral side, but there was no increased incidence of paranasal sinus in patients with Concha bullosa or nasal septal deviation. These are my references. Thank you.
Thank you. Now I request Dr. Sambaji sir to felicitate Dr. Kabilan.